Pretty good. Everything's going well.
We are a clinic for the City of Greenville employees. We see a lot of employees when they're sick. We'll see anywhere from 10 to 15 a day. Common cold, flu, sinus infection, muscle pains, backaches, headaches, high blood pressure, feeling faint and dizzy, or injured at work.
I walked out of here feeling like they had looked me over head to toe, and I mean, it was like going to a specialist. You do not pay your copay. There's no copay. Some of the drugs they have here, you don't pay for those either. You don't have to take time off for work to come here, because otherwise, if you went to your primary care physician, you did have to take off time.
Well, they like the convenience of it, first and foremost, and they also like the confidentiality of it. It's away from our work location, so they can use it in confidence, but they also get to use it without using their sick leave, and they get to use it without any cost to them. So those are huge wins for our employees. Every employer is experiencing increased healthcare costs, and we were looking for a way to manage that so that we could have sustainable health care. The first year, we saw savings that amounted to over $140,000, which we feel is awesome.
It blew me away, because this is not an on-edge thing that they've done. It's just a outcome of the hospital and the City of Greenville working together, and yet I walked out and felt like I'd been to a specialist. And I think that's important, and I think that shows the employees that the upper management understands that if they want to have good employees that are working, that they've got to take care of them by giving them a place to go if they have health concerns.
I'm a nurse, but I'm also a patient, and I have family that have been patients and have used primary care providers, the emergency department, other areas in the hospital. So if we can provide a value-based quality service that's in and out, quick, but also familiar. And you know, I know the history of someone. They don't have to sit down and tell me 3 times, because I remember them. I know who they are. You know, we're not trying to take the place of their primary care provider. We're trying to provide a service to them that's a cold or quick and easy, or a quick injury. And you know, if we need to go beyond that, we can.
Easy to get in, easy to get out. And you want to see a nice smile and professional, this place.
I want everybody to be an advocate for their health, because if we aren't, then we're going to fall through the cracks somewhere. And I mean, my dad was 53 when he died of a heart attack. And so I'm predispositioned for that already. And so I have to be my own advocate, and I have to watch what I eat, watch my weight, I have to exercise, all that stuff. And here at the clinic, that's what they help you do.
Vidant has been just great about jumping ahead of the curve and making these clinics a priority. I think it's the wave of the future in healthcare. I think it's going to be, people are going to start demanding that their employers have clinics. It's what the future of healthcare could very well be for us all.